It's been about a month since we last spoke to our medical officer of health, Dr. Janet DeMille. Since then, the province has made second COVID-19 boosters available to everyone over 18. Children under 5 can now be vaccinated against the virus. And monkeypox has been declared a public health emergency by the World Health Organization. So we decided it was time to check in with Dr. DeMille. She joins me now. Good morning.
Good morning, Mary Jane.
So how is the uptake on the second booster so far?
So we have had a fairly significant response of people being able to come forward, and certainly we continue to encourage those who, are at greater risk, including those people who are older, for example, over the age of 60, and anybody who's sort of immunocompromised or underlying health issues. So we have had many people come forward, and that's really nice to see. I think with the younger group, the ones when it's sort of 18 to 59, there's been a lower uptake of that overall. And I that's okay. I think people, we really gave people the option to choose and wanted to make it available to them. And, there is benefit in terms of, adding that more protection for those individuals. But because they're younger and maybe less likely to experience severe illness, then there may be sort of overall less benefit, but still benefit. And continue to encourage people, though, if they're older, more at risk for this, get their second booster dose, or even if and individuals who haven't had their first booster dose, regardless of their age, those are individuals who may have received their second dose even up to a year ago. So their vaccine protection could be waning. And so they could consider even coming forward for their third shot or the first booster.
Now, it's been suggested that healthy people may want to hold off on the second booster because we're anticipating a new shot in the fall targeted at Omicron. Have you heard anything about the timeline on when that might happen?
At this time, the timelines are still uncertain. I think that we're in regular conversations with the Ministry of Health, who is connecting with, of course, the federal Health Canada and the federal supply, and we're kind of planning that there might be a rollout of a new vaccine, a bivalent vaccine that could start in September, and of course it will start with those that are at higher risk, older folks in long-term care homes, for example. But at this time, we don't have actual confirmation of actual dates.
Mm-hmm. And what advice are you giving people about whether or not to get that second booster, or whether to wait, all those questions?
So I think for, I often focus on those at higher risk, right, which is primarily age. The older you are, the more vulnerable. As we get older, they're more vulnerable to infections like COVID or flu or other types of infections. And also the immune response to vaccines can be less. So, that's why we actually have higher doses for, in flu or some of the COVID vaccines, it's a higher doses for people who are over the age of 70, just to try to make sure we're really prompting the immune system to respond. So certainly those individuals, people who are immunocompromised, and there's quite a few immunocompromised people because there's a number, lots of medications that can impact the immune system. So certainly encouraging those individuals, to get the booster. They can talk to their healthcare provider. They can come to our clinics and talk to us as well if they're weighing out their options. And I think with the uncertainty of the timing of the fall booster campaign, it's still not too late to get those vaccines. Now it might delay depending on how the booster vaccine will roll out, but and it might delay their ability to get that booster dose, but they will have that additional protection with whatever dose they get right now.
Mm-hmm. And what kind of uptake are you seeing on vaccinations for children under 5?
So So we've had a number of people, really parents, I guess, book in, and we have been seeing in every clinic that we are currently operating. Then that rollout continues. So the health unit is doing many vaccines here in Thunder Bay and nearby communities. We're also, seeing primary care, requesting some of the vaccine, and working in communities outside of Thunder Bay, including in the district and First Nation communities, to ensure that they have access. So I do anticipate that the numbers will go up over August as this fully rolls out and people start administering it more. But we have been seeing a number. There's always sort of people who have been waiting and come forward fairly quickly. There's others who tend to wait a little bit, perhaps wanting to be more informed, perhaps wanting to talk to their healthcare provider prior to getting the shot. But we will have it available when people want to come forward to get it.
Now, previously, when the push was on to get, as many people vaccinated as possible, there were some drive-through clinics or neighborhood clinics or other initiatives for people who may face some barriers going to the usual clinics. Are there any plans to do that kind of thing going forward?
Yes, actually, I think we have some drive-thrus that are happening this week, and we are not, as many people know, we're not at the CLE Coliseum right now. We will be getting back into there back in August 17th, but we have done. We were at the Da Vinci recently, Italian Cultural Center next week. We have plans. We're engaging with the municipalities outside of Thunder Bay to look at where we can deliver clinics. So people can follow our website and social media channels and where we were going to post that. And, we are definitely looking to sort of diversify and our options that we're offering people and going to different locations and working with partners so that people have good access, whether it's right now or for whatever age group, but also as we prepare for, the broader booster campaign in the fall. So, we do have mobile clinics, and we've moved to a model where we can be overall more mobile.
Mm-hmm. Now, when we last spoke, we had just seen a few cases of the new BA.5 variant in Thunder Bay. What are you seeing now with regard to the new variants?
So I wouldn't be surprised if all our cases right now are BA.5. So the latest data that I've seen that's actually going to be posted on our website sometime this morning shows that in mid-July, about 72% of the cases that were the samples where there was whole genome sequencing were BA.5. So that was, about 2 to 3 weeks ago. And that was just a little bit below. Ontario was at 78%. So we've really caught up. We almost caught up to Ontario numbers by mid-July. And given that it's been a couple of weeks, I wouldn't be surprised if it's 100% BA.5 right now.
We've been hearing more about the impacts of long COVID. What do you know about that in our area, in our city, in terms of how many people might have long COVID? How many people are being affected by that?
Yeah, and you know what? That is one of the things that I think we don't know enough about, and because we don't know enough about it, it's hard to communicate on it. But the impact of, who gets long COVID, I mean, that could be any age, and some of the stories of hearing about people with long COVID are certainly very, significant in terms of the impact that it has on their lives. And now it's reassuring that, many people with long COVID, which is basically having symptoms sort of at least 3 months after their COVID infection, many do improve eventually, and certainly by 12 months they can be back to their pre-COVID state. But there are cases of people who still have symptoms, and it's very significantly impacting that really come from the first wave and the second wave of COVID, which was a couple of years ago. So I think this is something there that we really do need to understand more and look at what are the best ways to help people, to manage, to treat meet people who might have this, and really being able to communicate about what the expectations are. But certainly when we talk about COVID and COVID infections and people taking precautions, I think the uncertainty around long COVID, like with the vaccine and people having COVID, we've certainly seen a reduction in the serious illness. People are much less likely to require hospitalization if they get COVID. But certainly there's a lot of uncertainty about the risk for long COVID. And also, the concern now is also people who have repeated COVID infections. So as we continue to navigate, these different waves, we're in the third one that we've had in 2022 right now. And if people get COVID, more than once, what are the complications of that, whether it's long COVID or other types of complications? So certainly very much encouraging people to continue to take those precautions and be vaccinated, for example, and just to as much as possible reduce their risk of getting COVID while still living their lives.
All right. And before I let you go, let's turn to monkeypox.
Right.
We haven't talked at all about that yet, but we're hearing more about it.
Yep.
Have we been seeing any in Thunder Bay?
So we don't have any confirmed cases in Thunder Bay. A couple of tests have been done, but they were not monkeypox. So that is very reassuring. We continue to work a lot with the province and to understand, the transmission. And we are, because I know people are asking about this, we do anticipate that we will have more, we will have some monkeypox vaccine. Imavune, sorry, I mispronounced that, but that we will likely have that very shortly, just a small amount, but we will be rolling it out. Now, there's a very specific eligible group at this time, but we do anticipate getting more over the month of August and being able to roll that out to especially the higher risk groups.
All right. Thank you so much for joining us and giving us this update.
Yeah, thank you for the opportunity.
Bye-bye.
Bye-bye.
Dr. Janet DeMille is the Medical Officer of Health for the Thunder Bay District.